Hi, good morning, Leon. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 22nd of February 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Leon Alfred.
And what is your candidate number, please?
My candidate number is 202321445.
Thank you. And you are taking this test as a nurse?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Next, we can move to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
What are your professional goals?
I have several professional goals. A few important and most achievable professional goals in the near future are joining the Emergency Nurses Association and becoming an emergency room nurse practitioner. The second is to earn my master's in nursing. I love teaching, and also I would like to guide young aspirants to become successful nurses and have excellent careers. Thus, I hope to mentor nurses and share what I have learned.
What are your strengths and weakness?
My greatest strength comes from my ability to educate and empathize with patients. I can speak in their terms and help them understand what's happening with their bodies. I strive to enter into their shoes and treat them as people first, not just patients. My greatest weakness is overcommitting. I am so passionate about the job that I try to do too much at times. I need to slow down and trust my team.
Do you like working with a team?
I thrive while working as a part of a team because of my ability to adapt. I find that working on a team allows for the best outcomes for patients. Everyone has a different way of looking at a problem, and multiple perspectives can bring about creative solutions to issues. Also, working on a team motivates me because I enjoy celebrating the successes of others. However, I feel confident in my ability to work alone as well.
Tell me how you collaborate with other healthcare providers to provide the best care possible.
Collaborating with the entire healthcare team is critical for the nursing profession. I learned to do this in nursing school and gained a greater appreciation of the benefits of working as a team as I began working in healthcare facilities. I value the opinion of other healthcare professionals, including the doctors, specialists, and everyone else involved in the patient's care. I also recognize the contributions made by non-healthcare staff.
Nursing can be stressful. What measures do you take to deal with the stress related to this job?
Stress is part of my job. However, I never let it get to me. If I find myself getting stressed out while working, I look for opportunities to take a break, laugh, or commiserate with my coworkers. Off the job, I make sure to keep myself in good health by eating right, getting a lot of sleep, and exercising. I also practice meditation, which is very helpful.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good afternoon. My name is Leon, and I will be attending to you here today. How are you now?
Good afternoon, nurse. I am getting better now. Thank you for asking.
All right. For confirmation, may I know your full name and age, please?
My full name is Mihiraa. I am 57 years old.
Thank you for the confirmation, Mihiraa. The purpose of my visit is to do the clinical observations, such as to take the temperature, check blood pressure, etc.
Okay, nurse.
May I know how you are feeling right now?
During the allergic reaction, it was really frightening. I couldn't breathe at that time. Now, my breathing is getting a bit easier. But I really have a bad headache.
I can understand your situation. Mihiraa, the possible causes for your headache might be dehydration, exhaustion, or the after effect of an allergic reaction.
Okay, I got it.
Don't worry, Mihiraa, I can provide you with pain relief medications, and also a cup of tea, which will make you more comfortable.
Thank you, nurse. Pain relief and a cup of tea sound like a good idea.
Great. Mihiraa, do I need to address any of your concerns?
Yes, nurse. I wish to know how long I will need to stay in the hospital.
Your thoughts are reasonable, Mihiraa. However, I am sorry to say that I won't be able to provide you with a time scale for your hospitalization. It is the doctor's decision, and is based on several factors too.
Oh, all right.
Mihiraa, considering your safety, you are hospitalized and being insured. It is really essential to have close monitoring to ensure your condition is getting stabilized. In your case, breathing, oxygen saturation, blood pressure, and temperature are a few parameters we are checking. Hence, the doctor's decision is vital for your discharge. I hope I am clear to you.
Yes, nurse. I understand your words. Also, I hope my chemotherapy treatment won't be affected due to this allergic reactions.
Mihiraa, I really wanted to appreciate you for being optimistic. You are looking forward, hopefully, to continue your chemotherapy sessions. Well, I would like to point out to you that there are multiple ways to deal with allergic reactions. As a result, I can assure your treatment will not be affected.
Oh, good to hear that, nurse.
Let's discuss some of the possible ways of dealing with this allergic reaction. First of all, we can try alternative chemotherapy drugs and can continue treatment with best suited one. You will be provided with immunotherapy to enhance your immunity. Additionally, by slower delivery of treatment, we will be able to deal easily with any allergic reactions, even if it happens. More pieces of information will be provided by the doctor.
All right, nurse.
No worries, Mihiraa. It's part of my duty. Do you have any other questions?
Nurse, can you do me a favor?
Yes, of course. I am happy to help you.
Thank you for your willingness. Actually, I was only supposed to be in the hospital only for a few hours. So, my family is going to be expecting me home soon. And they'll be worried if I am late.
Yes, you are absolutely right. I will definitely contact your family straight away after the clinical observations. I will inform them of the situation and also arrange for a visit with an overnight bag, as things are not yet confirmed.
That will be a great help.
With pleasure, Mihiraa. Is there anything else I can do for you?
If you don't mind, I am very hungry, because I haven't eaten anything since early this morning.
Don't worry, I will check with the doctor about your food, and I will make the necessary arrangements for that.
Thank you, nurse.
So Mihiraa, I need your consent to do the clinical observations.
Sure, nurse. It's fine to do the clinical observations. You may please proceed.
Thank you for your consent and cooperation.
That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.